Curious and engaging, Diane Meier enjoys weighing all the options. Growing up in Chicago, she remembers, there was always this atmosphere around the house of questioning, talking about why things are the way they are, and what would be needed to change them. And that's kind of the air I breathed as I was growing up. Diane graduated Oberlin College in 1973 and attended Northwestern Medical School afterwards. During her residency rotations, she muses, it was difficult to think about focusing on one organ or one disease without thinking about the human being, the person that was influenced by that disease. For me, it didn't make sense to write someone a stack of prescriptions, for instance, without knowing if the patient could afford them. It was too narrow of a perspective. So in the early 1980s, Diane chose to specialize in the then relatively new field of geriatric medicine because it offered a comprehensive, holistic approach to the patient. She joined the faculty at Mount Sinai in 1983 as part of the first freestanding department of geriatrics in the country. But during this time, she was becoming more and more concerned about the subspecialization and fragmentation of medicine, she says, and my sense that the patient and the family were getting lost in the rapidly evolving technology, and the fact that every body part, every disease had a different specialist. This unease led to a sort of crisis of faith for Dr. Meier. I started wondering if there was something wrong with me, she says, that I found this so disconnected from the real needs of patients and families. Fortunately, several unique private sector funding opportunities aimed at creating social change in medicine became available and helped steer her career toward palliative care, a field in which she feels she's found her true calling. Among her many notable achievements, Dr. Meier has helped make palliative care accessible through the entire trajectory of cancer, so that care focusing on quality of life is available for patients even in the early phases of illness. And as a direct result of her work, over 60% of all American hospitals, and more than 80% of all hospitals with more than 250 beds, now report having an active palliative care program. Meier says there's no such thing as a typical day in her work. She travels extensively, either meeting with people in Washington or giving talks at conferences or participating in meetings to try to integrate palliative care into healthcare reform and health policy. In 2010, Dr. Meier was named one of the 20 people who make healthcare better in the US by Health Leaders Media. Intelligent, perceptive, and uniquely present. It's not so much what Meier knows, but what she understands that seems so powerful. Yes, if people are comfortable, she says, if they're not depressed, if their families are supported, if they feel like there's a reason to get out of bed in the morning, of course they will live longer, she laughs. For the public, that's a no-brainer, right? But for many physicians, that is cognitively dissonant. So we have to get that across to the medical profession. Meier is encouraged by the number and caliber of young healthcare professionals she sees who are now choosing to enter palliative medicine. It is such a privilege to work with people who are facing these kinds of challenges. People often say to us, isn't it depressing to do this work? And the hidden secret in palliative care is the front row seat you get on love, courage, the things that really matter in life. I am repeatedly overwhelmed with respect and appreciation for human capacity and resilience in the face of what seem like daunting and devastating challenges. Tonight we honor Dr. Diane Meier, a dedicated standard-bearer in the field of palliative care. Her passion, determination, and strategic leadership have literally changed the landscape of medicine by helping people feel and live better as they struggle with serious illness.